Welcome everybody, and thank you so much for joining us for this month's webinar as part of the Elevating the Medicaid Enrollment Experience project. My name is Fara Erzouki, and I'm a Senior Policy Analyst at the Center on Budget and Policy Priorities, and I'm joined by Jen Wagner, who's the Director of Medicaid Eligibility and Enrollment. So today we'll be diving into streamlining eligibility and enrollment for the non-MAGI population. And just a few housekeeping items before we get started. We plan to have plenty of time for questions, so please submit your questions through the Q&A function, not the chat box, and we'll be moderating those throughout the presentation. And after the presentation, we'll be sending out a recording and a copy of the slides. Great, so this is our agenda for today. So we're going to start by going over what is the non-MAGI population, and then Jen is going to guide us through state and county administration of non-MAGI Medicaid, eligibility rules and the application process, along with non-MAGI eligibility during the pandemic. And then we're going to close us off with an overview of asset verification systems, which draws heavily on a paper that Jen and I recently published on asset verification systems and non-MAGI Medicaid that we'll be linking at the end, along with resources and questions at the end. So we're going to go ahead and start with a poll. So this is our poll, which asks, how comfortable are you with non-MAGI policy? The answers are, I dabble if absolutely required, pretty comfortable, and I named my dog Katie Beckett. So we'll just give folks a minute to respond to the poll. Maybe we could show the results now, and if folks have answered. Cool. Okay, so it looks like we have a pretty decent spread across the board. A few people don't really know much about non-MAGI policy. It seems like we have a lot of folks in the middle that might be somewhat or pretty comfortable, and then we have a few experts on the line. Great, so let's go and dive right in. So what is the non-MAGI population? So we can start by talking about the term non-MAGI, and this is really a term that came about around the time of ACA implementation. So when the ACA expanded coverage to more groups of people, implementation brought about a new way of calculating income that was termed MAGI, which stands for Modified Adjusted Gross Income. So this left seniors and people with disabilities, which is the traditional Medicaid population, with the old rules of budgeting, which is why they were termed non-MAGI. So this is a complex population. There are lots of different categories with different eligibility factors, and there's also lots of state variability in the non-MAGI categories. So this is also a space that doesn't necessarily get a lot of attention. The eligibility and enrollment world in Medicaid traditionally focuses on the MAGI population, and when folks discuss the non-MAGI Medicaid population, those conversations usually don't revolve around eligibility and enrollment. And so the goal for today is really to bring those two topics together and discuss non-MAGI eligibility and enrollment. So the non-MAGI population is subject to different income rules than the MAGI population, which Jen will touch on shortly. Most are also subject to an asset test. That means when they apply for coverage or their coverage is up for renewal, their assets, which consist of things like money in the bank, property, and other things, are assessed, and their eligibility is determined based on whether those assets are within a certain threshold. This is also a unique population, aside from just the eligibility and the categories. They're a population with complex needs. So this group is largely seniors and people with disabilities, which are a largely vulnerable population who face challenges even accessing the enrollment process, especially with the need to provide extensive documentation. So it's really important for us to think about ways to streamline and improve their interactions with the Medicaid process. So as mentioned, the non-MAGI term generally refers to seniors and people with disabilities. So this is a very brief overview of the various non-MAGI categories. We could definitely have an entire webinar just on dissecting the different categories, but this is really meant to just be a high level, big picture of what the categories typically entail. And so states can opt in or out of various coverage pathways. So you definitely see variation among states in which of these categories of coverage each state opts into. And so generally, many people who qualify for non-MAGI Medicaid are recipients of Social Security income. Non-MAGI Medicaid also covers dually eligible people. And so these are folks who are eligible for both Medicare and Medicaid. And these folks are typically in what's called the Medicare Savings Program, which depending on their income level, they get either partial or full coverage through Medicaid on things like premiums and cost sharing. There's also the medically needy population, which is sometimes characterized as the spend down population. So these are folks whose income is too high to be categorically eligible, but that they have a costly medical need. And so with these folks, they're actually required to spend down the difference in income on their medical expenses before they get covered by the Medicaid program. And similarly, we have folks that are receiving long-term services and supports. And with this population, they're actually required to provide bank statements for what's called a 5-year look back period. And so this period is the length of time prior to the time that they apply in order to verify that they haven't transferred large amounts of assets elsewhere to bring their assets below the eligibility limit. Working disabled people are also covered under non-MAGI Medicaid. So these are folks who are receiving disability benefits, but still work. And so this coverage allows them to ensure that they still have access to care as their income increases. Children who have severe disabilities are also covered under this type of Medicaid. So these are children who would otherwise be institutionalized, but this coverage allows children to stay at home and receive the care that they need and still be in their communities. And lastly, there are folks who are covered under various waiver programs that are typically 1915 waivers. So these waivers help provide coverage to populations who otherwise would not be eligible. So these are folks, some states have opted into providing coverage for folks with mental health conditions, along with home and community-based services and other types of coverage. So I'm going to go ahead and turn it over to Jen.
Great. Thanks so much, Fara, for that overview of the different types of non-MAGI. As you mentioned, it's overwhelming, all the different categories, and we could spend a whole webinar on it. And many of you know the details and spend a lot of your time in the nuances of those. But today we're going to focus a little bit more on the process of enrolling in Medicaid as a non-MAGI recipient and renewing coverage. So the first thing when we talk about that is to really understand how it's administered at the county level and the state level. We talk a lot about SNAP and Medicaid, and if they're in the same agency, if they're in the same eligibility system or not. Non-MAGI adds an extra layer on that. So on this slide, you'll see the 3 primary setups we see in a state for where non-MAGI sits. Some states have everything integrated. SNAP, MAGI Medicaid, non-MAGI Medicaid, sometimes other social service programs are all in one eligibility system. And there's a higher chance that the non-MAGI processes follow some of the streamlining techniques that have been employed for MAGI Medicaid. A second setup is SNAP is in a separate eligibility system, but both MAGI and non-MAGI Medicaid are together in one eligibility system. The third setup that we see frequently in states with a state-based marketplace is that MAGI Medicaid is in its own system, often a newer modern online system, sometimes in combination with a state-based marketplace, but non-MAGI Medicaid has sort of been left behind. It's still in a system with SNAP, often a legacy system, and administered by a different agency. And so these are important considerations when we talk about streamlining procedures, changing policy, changing application processes and notices. Depending where the non-MAGI Medicaid sits in your state and which agency administers it, depends on how likely we are to be able to kind of implement some of these streamlining techniques. It can be done in any setup, but it's important to kind of really know who's in charge and what the constraints and what the opportunities are. So when we think about the administration of non-MAGI Medicaid, on the next slide are a couple of considerations. So is non-MAGI in a modern system? And again, modern we use loosely. We know that they're not great, that some of them are 10, 20 years old, but I'm talking like an online interface type thing versus a legacy 1970s COBOL style system. Because that affects the ability to update rules, forms, and the ability to automate. A lot of you know a lot about MAGI streamlining that includes ex parte renewals and automatic determinations and things like that really are not possible within a legacy system. And so we need to kind of understand what the options are there. So this affects the application, and if it's a joint application, not just between MAGI and non-MAGI, but across other social service programs, it affects families. We all know the strain of families where maybe the parents are in marketplace plans, but the kids are in Medicaid, and how difficult it is for a family to manage multiple notices, multiple agencies, multiple renewals, all of that. Well, the same challenges may apply when a family is across different programs. If non-MAGI and MAGI are in different entities, then they may have to report changes multiple times, demonstrate their eligibility, renew, and things like that. Finally, this is really relevant for transitions. As we'll talk about a little bit later on, MAGI and non-MAGI are not immutable characteristics. People change. They might be MAGI and then approved for disability. They might be receiving disability and lose coverage. Or you've got folks turning 65 who need to transition. If it's in the same eligibility system, there's a possibility, not certainty, but possibility that there's a smoother transition across groups. When they're in different eligibility systems, there's a higher likelihood that one kind of terminates the client and says, you might be eligible for another program, go ahead and apply to this different entity. And so understanding how folks flow through those different systems is important. Another thing to consider is coordination across programs. And again, this can be easy or hard in an integrated or divided system, but we want to look at cross enrollment in SNAP. Is there a joint application for elderly and disabled individuals? There's been a lot of effort on the SNAP side to increase enrollment in SNAP for seniors and people with disabilities. Previously, years ago, the minimum benefit was $10. A lot of these folks only got that and decided it wasn't even worth enrolling in SNAP. But that minimum benefit has increased, and through greater attention to things like medical expense deductions, most individuals get a higher benefit now, and certainly a much higher one during the pandemic. So some states have set up a SNAP Elderly Simplified Application Project, ESAP, designed to streamline enrollment for this population. Some have gone a step further and set up dedicated units that are focused on this population and help them walk through the process, complete renewals, and all of those things. But many of these folks also are eligible for Medicaid. And if they can get help paying their Medicare premium, that's almost $150 a month, which is significantly more than even the kind of maximized SNAP benefit that folks are helping them get. And so we need to make sure that this progress made in the SNAP arena is carried over to Medicaid as well, and that individuals who are enrolling in SNAP through ESAP or otherwise are also connected to the rich benefits available through Medicaid. Another aspect here is using SNAP data for renewals. For people who are enrolled in both programs, the SNAP information is usually very current and very detailed. And as you've heard us talk about before, it can be leveraged to help with Medicaid renewals. And so it's worth considering how these programs are coordinated in order to share that data. Finally, there's a huge opportunity to align Medicare Savings Program criteria with low-income subsidy criteria. So individuals on Medicare may be eligible for help with their Part D premiums and cost sharing. So that's their drug plan. If you think Medicaid is complicated, Medicare is even more fun with all the different parts. But as individuals might apply, as low-income individuals apply with Social Security Administration for help with their Part D coverage through low-income subsidy, SSA is required to send information to the Medicaid agency because those individuals may also be eligible for help with their Part B program, Part B premium through Medicare Savings Program. And so that information is flowing to the Medicaid agency, but sometimes it doesn't match what the Medicaid agency needs. It might not be detailed enough. It might be that the Medicaid program has a lower asset threshold or a different income limit, such that the information coming from SSI doesn't meet the needs for income and asset verification. In which case, the agency may just send out an application and say, hey, you might be eligible for Medicare Savings Program, apply. And that really minimizes the streamlining benefit of this data sharing. And so another aspect to consider is if you can align MSP and LIS criteria so that that data sharing seamlessly enrolls individuals who apply for help with Part D and can also get help with Part B. So that's a huge area to consider. Next, we're going to talk about eligibility rules and processes for the non-MAGI population. Again, here are a lot of areas where there's a lot of room for improvement and often not enough attention. So first, looking at the eligibility rules. The bottom line here is state flexibility. Within MAGI, much of the criteria are federally set. There is no asset test, thankfully, for MAGI. In many cases, the maximum income limit is federally set, 138 for many populations. How income is counted is reliant on the tax code and is federally determined. Not so with non-MAGI. There's a lot of state flexibility. First of all, they can set different income limits. There's kind of a minimum and maximum for most categories outlined in federal statutes and regulations, but they have a lot of flexibility to raise that. They can also raise or eliminate asset limits, and some states have for different categories of non-MAGI beneficiaries. So that's the straight up limits, but they can also affect how income and assets are counted. So within income counting rules, they can disregard a portion of income. So that's taken off the top before an individual's income is compared to the eligibility threshold. There's also room for earned income disregards. There are lots of 33 1/3 and different complicated rules out there for individuals who also have earned income in addition to their disability or retirement benefits. And that can be disregarded in a way that kind of in a backdoor way expands eligibility. Even though the eligibility threshold stays the same, if you take out various chunks of income that someone's receiving, they're more likely to qualify. Similarly, states can both set asset limits, but also set the asset counting rules. For example, the home equity limit. For an individual who owns their home, how much of that value can be excluded and not counted towards an asset? And there's other flexibility within there. So this is just kind of meant to highlight the fact that states have a lot of freedom in this area, as well as other kind of processes to expand things and make things more accessible for this population. As far as the eligibility process goes, let's start with application. So many of the regulations that apply to MAGI populations and help streamline the process also apply to non-MAGI populations. So the regulations that say that you must be able to apply online, by phone, by mail, and in person apply across Medicaid categories. Let's take online to start with. What is the process like for a non-MAGI applicant? Can they actually apply online? If they apply through Medicaid and it's only MAGI covered through that application, what's their pathway to apply for non-MAGI? Do they have to do another application? Is it a second step? Can they even apply online? What's that like? Next, looking at by phone. The regs require that an agency must accept telephonic signatures. Is that happening in your state? Particularly in states where non-MAGI was kind of left behind with SNAP. Many of those states don't have telephonic signatures set up for SNAP. So are they able to accept that for non-MAGI? Again, these are requirements in the regs, so good hooks to kind of pursue if your state is behind on this. For the application form, looking at if someone's going to apply by mail or in person, the regs set out two different examples or two different possibilities. They can use a single streamlined application plus supplemental forms. So the single streamlined application may identify somebody who's eligible under a non-MAGI category, but doesn't collect all of the information needed for a full eligibility determination. So there may be supplemental forms. Are those included or readily available when someone fills out the single streamlined application, or do they have to submit the regular application and then they're sent and have to complete supplemental forms, all of which introduces opportunity for missed mail, inability to understand, not taking those next steps in a way that decreases access. The alternative is that the state can set up a non-MAGI app that must minimize the burden on applicants. So what is that like in your state if that's the way, if that's the avenue that your state is pursuing for non-MAGI individuals? And all of these must be submitted to the HHS secretary. So there should be some kind of formal process. I don't know how aggressive the HHS review process is, but again, these are some federal requirements that might be some hooks to kind of review your process. Unfortunately, for the non-MAGI population, an interview is permitted. You may recall that the regs prohibit an in-person interview for the MAGI population. Most people think it prohibits it for any type of interview for the MAGI population, and most states don't do it at all. So let's leave that alone. But it is unfortunately permitted on the non-MAGI side, and some states still do require it. Is that necessary? It's been going pretty well for the MAGI population for the past, 7+ years. So that could be an opportunity because as we all know, that can introduce a whole lot of burden, especially for a senior or person with disability who might have transportation or mobility challenges and be unable to come in. At the least, is there a phone option for that, even if an interview is required? So let's make sure that that's not a barrier for individuals. Next, we'll talk about additional aspects of the application process. So again, a lot of the MAGI regs do apply to the non-MAGI population. An agency can accept self-attestation for most factors, except citizenship and immigration status, same exception as in the MAGI world. They can verify income post-enrollment. they must use data sources to verify eligibility. And they also must apply a reasonable compatibility standard or policy. So if the client's attestation and the data source are both below the eligibility threshold, they're eligible. No further verification should be required. Even if they're really far apart, but they don't affect eligibility, the individual should be eligible. I've heard some crazy stories out of states that they're requiring individuals to submit documentation of their Social Security income. That's bonkers. I mean, that is very clearly available to states through Social Security Administration data exchanges. We know that they're using them. And so there are some kind of archaic processes that are still out there in the non-MAGI population, more reminiscent of the days where people were in person and you had to submit all this documentation. It was more of a caseworker, one-on-one type interaction. Some states are still stuck there for this non-MAGI population. And we need to really shake that loose in places where the processes are super burdensome for individuals. As far as processing times, there's a requirement that applications must be processed in 45 days for most cases. The time frame is 90 days if the individual is seeking a disability determination. This is most relevant in non-expansion states where individuals wouldn't otherwise be eligible unless they demonstrated their disability. In most expansion states, this should not be a common issue. You may have a few situations where the benefit package for a disability pathway is better or different than for a regular MAGI pathway, in which case it might be necessary for an individual to get the disability determination. But there should be very few disability determinations going on in expansion states, I would hope. Next, let's look at the renewal process. So the regulatory language here is that non-MAGI cases must be renewed at least every 12 months. So unfortunately, that does allow states to do more frequent renewals, most often at the 6-month mark. The regs allow a 12-month eligibility period, and that's what really should be implemented. There's a strong argument here that this is a very stable population. The majority receive Social Security income of some sort. Few have earned income. I know some do, but most of them have very stable income, pensions, Social Security, disability, etc. And there shouldn't be any motivation to review them more frequently than needed. So certification periods should be extended to 12 months. Also, the regs require an ex parte renewal for this population. And that's requiring the state or county to pull from available data sources and try to renew eligibility based on that before requesting any information from an individual. This is another area where states are behind. Maybe they're in a legacy system that doesn't allow this sort of automation. In some states, they just never got around to this. So much of the focus was on the MAGI population. Many states were hesitant to complete ex parte renewals because they had to verify assets. And that has partially been solved through the asset verification systems that Fara is going to talk about in a little bit. So really, states need to be doing ex parte renewals and need to be doing it for a substantial chunk of the population. Again, stable income, most of it electronically verifiable. We should be able to do this here. There's an option that a state send a pre-populated renewal form if they're unable to complete the ex parte renewal. And according to a Kaiser survey, 70% of states report using. So that's great. It's worth reviewing what is pre-populated. Some agencies will say, oh, there's a name and address on there. That's pre-populated. No, we really want all the available information to be on a form to simplify the process for a beneficiary to kind of identify if anything's changed or not and make it as simple as possible. In addition, it's optional to offer a reconsideration period to this population. And this is when somebody falls off at renewal, when they lose coverage. If they seek to regain coverage within 90 days after that loss of coverage, they can just complete the simplified renewal process without having to submit a new application. So unfortunately, churn happens, and this is a way to kind of simplify the on-ramp back onto the program. And according to that Kaiser report, 85% of states report offering. So the last thing to consider in this kind of eligibility process section is transitions. As we talked about before, people often switch between categories as they go through their lifetime. The agency is obligated to consider all bases of eligibility. So if somebody applies for MAGI and is found ineligible, they should be automatically considered for a non-MAGI category. If somebody loses coverage in one category, the agency is required to go through that progression, or every state has kind of a different waterfall or different term for going through the different eligibility categories and trying to see if somebody is eligible for something else. So this is an obligation. So I encourage you to review the agency process when somebody turns 65, when they become disabled, when a child turns 19 or whatever the age out age is in your state, in a non-expansion state. Are they just terminated and told, you might be eligible for something else, good luck? Are they sent a whole new application? Or is there a more streamlined transition that actually helps to gather the information required for the determination for the other category and walks the client through that or makes it as easy as possible? So another area to look at. Next, we're going to talk about non-MAGI eligibility during the pandemic. Like with many programs and many people's lives, this got upended a little bit during the COVID-19 pandemic and offers an opportunity to kind of put the pieces back together in a better way. So the first thing to consider is that a lot of states have submitted state plan amendments during the pandemic, some of which affected the non-MAGI population. So some states have chosen to apply less restrictive income and resource requirements to the non-MAGI group. And this could include eliminating the resource test altogether during the pandemic, or something like self-attestation of spend down. As Fara mentioned, there's a medically needy category. And I know I've got legal service folks out there and other advocates who have probably helped somebody gather all their medical bills and prescription receipts and everything and try to submit it to the agency and get them to review that and calculate the spend down and help cover those bills and activate Medicaid for that client. So one option that some states have utilized is accepting self-attestation of the bills for spend down in order to kind of simplify things during the pandemic. In addition, some states have extended hospital presumptive eligibility, or HPE, to non-MAGI groups to kind of streamline their entry into the program. Has this worked? Have your states done this? Have there been benefits? Might it be worth encouraging them to continue after the pandemic? There's, of course, the continuous coverage provision that prohibits states from terminating coverage for most Medicaid recipients during the public health emergency. That's statutory, that's going away sometime. But most of the other things that states have implemented during the pandemic can be done anytime. This is not specific COVID-19 waiver authority or any other permission. What has been done is most states have done this through a disaster relief state plan amendment or a disaster change their verification plan. That has allowed them to do it quickly without some of the notice and comment and consultation things that are traditionally required. So it's been an expedited pathway. But again, these are things that a state can do anyway, anytime. They just need to go through the traditional change, the verification plan, or as a traditional state plan amendment, which might take a little bit more time, but is allowable. So now is the time to work with your state. If they have done something like this during the pandemic and want to continue it, if they go through the regular process now, they can have this continuity in place where when the public health emergency ends and these other authorities end, they've got the policy in place in a permanent way. So definitely worth looking at. Another aspect of the pandemic has been non-MAGI access. We're talking about seniors and people with disability. Oftentimes they have, again, mobility challenges. They may have difficulty using an online system, phone interactions, and many of this population did more traditionally rely on offices and in-person interaction. So how has their access been impacted? Many agencies push towards online and phone interaction and closed offices. We don't really know what happened to the non-MAGI population. Obviously, because of this continuous coverage provision, they have not lost coverage, and that's great. They've been able to maintain it, and we can't really see a particular dip in their applications versus others. There's not a lot of good data out there to compare. But we need to look at what the future looks like in your state. We've heard that some agencies are happy to close offices and save money on lease costs. In some places, working from home has gone well for eligibility workers, or they've amped up their call centers or their online systems. Will that work for this population? What barriers do they face? And what do state reopening plans need to look like in order to make sure that their needs are accommodated? Along the same lines, we're thinking about unwinding the continuous coverage provision. That's most likely, we expect that to end around January, although it could be later, but that's as soon as that it would end. Huge amount of work for agencies, huge amount of renewals to catch up on. So what is in their outreach plan? What is in their unwinding plan to really focus on this vulnerable population and make sure that they maintain access to coverage. So the last pandemic aspect to think about is that there was CMS guidance issued on December 22nd of last year that talks about the unwinding and what state options and requirements are. This was issued under the previous administration, and we do expect literally any day now some revised guidance that improves it further. But there's a lot of really good stuff in this December guidance, and it promotes streamlining of the non-MAGI population in order to help states with workload and other challenges when the continuous coverage provision ends. And within that guidance are recommendations on many of the things that we talked about already: longer eligibility periods, improved renewal processes, aligning MSP and LIS, less restrictive income and resource criteria. That's all in that guidance. And so, like a lot of things associated with the pandemic and unwinding, these are best practices that a state should do anyway. These are good things that help them. But the pandemic and unwinding of the continuous coverage provision presents a hook to really focus in on these things. As states are concerned about the volume of workload that's coming their way and trying to retain eligible people, this is a way, this is a forum to kind of get in front of them and say, hey, in order to help when you have this whole, huge workload, let's talk about some things that you can do. And it's not advocates just pulling these things out of nowhere. And this is specific stuff that has been encouraged by CMS, and you can point to this guidance and the continuous coverage provision and all of those things to hopefully get a little bit of attention to these issues, because many of these are relatively small changes that could be made in advance of the end of the public health emergency that would really have a substantial impact on state workload going forward. So with that, I'm going to turn it back to Fara to talk a little bit about state asset verification systems and how these are a great opportunity to streamline things in the non-MAGI world.
Great, thanks, Jen. So yeah, let's dive right into AVS. So what is AVS? So prior to the implementation of asset verification systems, the way that non-MAGI assets were checked was manually. So state agencies had to manually verify assets at application and renewal. And this manual process really caused lots of delays in the eligibility and enrollment process, and often led to applications being denied if folks couldn't secure and submit the required documentation. And this manual process was particularly burdensome for people receiving long-term services and supports because they would have to provide 5 years worth of bank statements. So in 2008, Congress began requiring states to implement electronic AVSs. And so these are systems that are run by state Medicaid agencies. They collect information directly through financial institutions, typically using a system that's operated by a third-party vendor. And this system helps them determine if the applicant or enrollee has assets below the eligibility limit to qualify for Medicaid. And so this is a typical AVS process. So let's start from the beginning. Someone who applies for Medicaid might be eligible for a non-MAGI category with an asset test. So that person must answer questions about their bank accounts and other assets. So that information is then given to the caseworker who submits the inquiry to AVS to attempt to verify the eligibility factors that were attested by the applicant against electronic data sources. And so that inquiry is sent, and the system, as mentioned, usually run by a third-party vendor, sends out inquiries to national banks and other local financial institutions. And so you'll notice here that there's also this other vendor section that links to things like vehicle ownership records and real property records, but we're really focusing here on the assets through financial institutions because that's what Congress required, and that's typically what an AVS that's run by a state agency has. And so those results are then returned, and that process can really take anywhere from minutes to days. And so once those results are returned, though, the caseworker takes action based on those AVS results. And so if the information is consistent from the client attestation to the data sources, then that person's application is approved. And if that information is not consistent, the caseworker then follows up with the applicant for additional verifications. And this process can also be used during the renewal process. So AVS is a relatively new technology, as mentioned, and states have experienced some limitations as they implement it. For example, not all financial institutions necessarily participate in the AVS system. So This is an issue particularly in rural settings with more local credit unions than national large banks, which makes it difficult to get everything needed to make a determination and forces workers to manually request asset information from those institutions. Results are also not always available in real time. So as mentioned, there's a really large variability in when results can be submitted to the asset verification system. So banks can take anywhere from minutes or hours up to days. And this again can vary based on the financial institution. Sometimes smaller institutions might have to manually process requests and return the results via fax or mail. Electronic data might also be lacking for certain assets. So while bank account balances are usually a little bit easier to get through AVS, electronic data isn't always necessarily available for other countable resources, such as life insurance and stocks and other types of assets. So this reduces some of the streamlining benefits of AVS by, again, making caseworkers to have to manually track down that information. Lastly, costs can also be high for implementing AVS. Most AVSs charge per inquiry, and that can get pretty costly. And there's also a cost involved in integrating an AVS into a state's eligibility system. So even though states are required to implement this AVS, sometimes the cost of these additional features can prevent them from using it to its fullest potential. Despite these limitations, though, there are best practices that state agencies can implement to maximize use of AVS. And efficient use of AVS at application and at renewal can really save time and benefit both state agencies and applicants, and can eliminate the need for applicants to go through the burdensome process of obtaining and submitting paperwork for their application to be processed, which again particularly benefits those seeking long-term services and supports who would otherwise have to obtain 5 years of bank statements. And many of these best practices that we'll talk about have actually been successfully implemented for MAGI Medicaid, as Jen mentioned, and can easily be adopted for non-MAGI Medicaid. So let's start with reasonable compatibility. So reasonable compatibility is commonly used for income verification, but it can apply to asset verification as well. So under this policy, what the client attests to and what the data sources say are considered reasonably compatible if they both are below the eligibility threshold. So under this policy, they would be reasonably compatible, even if there is a significant difference between the attestation and the data source, as long as, again, they're under the eligibility threshold and that the difference doesn't affect eligibility. So agencies should apply really clear and strong reasonable compatibility policies to minimize the follow-up that's required from the applicant. So this table outlines some recommended outcomes based on various scenarios at application. So for example, if you take a look at the second scenario, if the attested income and the AVS result for income are both below the eligibility threshold, so in this case, both the $1,000 at Bank A and the $1,800 at Bank A are below that $2,000 asset limit, that person's application would be approved, even if they are different, no matter that range of difference. And the agency in this case should not require any further information from the client. And then if you take a look at the last scenario, this fifth one here, it shows that there is an inconsistency between what the client attested to and what the AVS result shows. So in this case, if there is an inconsistency, the caseworker should request more information and verification from the applicant before terminating, and then only terminate them if they're found ineligible. So here are some additional best practices for state agencies to consider. So one example is post-enrollment verification, and this is when an application is approved based on an applicant's attestation. So after enrollment, the agency would verify that person's attested information through the AVS in the case of non-MAGI Medicaid. And so if the AVS results are found to not be reasonably compatible, the agency would then request verification from the client. But approving a person's Medicaid when they apply can ensure that seniors and people with disabilities can quickly access needed medical care. And then real-time eligibility is when a person's application is processed immediately or within 24 hours, mainly using automated data checks. And so AVSs do allow states to electronically verify assets at application and approve them in real time. And so to account for AVS results that might take days to return, as we mentioned, agencies may combine real-time eligibility with post-enrollment verification. And if the results are returned after approval and are inconsistent, they can request additional information. And Jen talked a lot about maximizing ex parte renewal, so I'll just briefly touch on it. But essentially, agencies are required to attempt ex parte renewals for all Medicaid cases, but non-MAGI cases are often excluded from this because it can be hard to verify all assets. But AVSs can play a really large role in increasing the ex parte rates for non-MAGI groups, given that accessibility to electronic data sources. And lastly, the federal government can also play a really large role in improving this process. They can do things like providing comprehensive guidance to states on AVS implementation and promote some of the proactive policies that we've mentioned. And federal government can also find ways to reduce costs of AVS contracts and potentially increase the financial support that they provide to states to ensure that they can access all relevant information for determinations. And so here are some of the resources that we mentioned and utilized throughout the presentation. So we have the Center on Budget's Asset Verification System paper that we recently released, along with some resources from the Kaiser Family Foundation and CMS that we hope will be helpful to you all as well if you need some additional information. So from there, we appreciate your time and thank you for joining us, and we can now open it up for questions.
Great, thanks so much, Fara. So I just want to encourage everyone to submit any questions you have through the Q&A function, or to submit through chat, or otherwise your experience with AVS. What have you heard about what's happening in your state? Have you heard of this? Have you heard of the vendors like Softian and PCG being involved? And is it working or not? Because one of the things we tried to kind of research for this paper was the relative success rate, and if it is, you know, finding matches or not. And as Fara pointed out, there are some limitations to the system as far as the timing on when they get a result, as far as what banks are included or not. But there is a lot of variability, as with everything, in state implementation. And if they're really using this intentionally from a streamlining perspective, or if it's kind of something they have to do and they're doing, but they're not working it into their system in a way that's designed to streamline. But the bottom line is, just think of this as another data source. Just as for income, the state might bounce off quarterly wage data or the work number or IRS data. Another thing that needs to be verified is assets. And here is a data source for them to use. So I think previously that was one of the main excuses and genuine limitations to streamlining things for the non-MAGI population, both at application and at renewal. But now that it's in place, every state has it in place. They had to have it done by 2020. There's opportunity, and some states implemented it to meet the deadline of 2020, but haven't fully integrated it into their eligibility system, into their renewal process, really analyzed the success, done caseworker training and other things to streamline it. So that's another area that could be worthy of a little bit of outside attention, pushing the state to use it in a more proactive way. So with that, I'll turn it over to Ina for some questions.
Thanks, Jen. Thanks, Fara. We do have a couple of questions. So the first one is, can you talk more about the nuances surrounding unwinding the PHE MOE for the non-MAGI population? And are there specific things advocates should be pushing with their state?
Yeah, I mean, a lot relative to non-MAGI is similar to what we're pushing for with MAGI around ex parte and address updates and strong communication to clients. Call center support, all of those things. But I think there should be a different angle taken towards non-MAGI and a recognition that this is a vulnerable population, that they have different needs, that there might be different kind of mechanisms to reach out to them or different entities that they may be interacting with that could be used as a trusted partner to get this information in front of them so they know what's coming. On the state side, I think there is a lot of low-hanging fruit around eligibility periods, around some sort of automation, around renewals and things like that that can be done. So it's a different hook. I think there's lower hanging fruit on the non-MAGI side than the MAGI side in some states, but of course that's going to be state specific. If non-MAGI is in a legacy system, ex parte may not be on the table right now, but it's worth looking into. Because again, these are federal requirements, and we are hoping that CMS is going to be a little bit more aggressive with states than they were under the Obama administration. The Obama administration cut states some slack, thankfully, with ACA implementation, while their own house was a mess with the federal marketplace. But now a lot of these requirements have been in place for a number of years, and states really need to be doing it. So hopefully some federal pressure will lead states to kind of implement some of the stuff that's been left behind. Let's see, a question from David on the latest on whether CMS will implement the recommendation from our paper. So David's honing in on one important area around renewals. And basically there was some CMS guidance that came out to states informally, we think as part of the PERM, the error review process, that said that at renewal, if there's no match in the data system, if there's no match in quarterly wage data or AVS for income or assets, then you actually need to go through the paper renewal process. You need kind of a fresh attestation that someone has no income and no assets. And we have found that very problematic. States have found that very problematic in that it really can lower their ex parte success rate, because unfortunately, a lot of households have no countable income or no countable assets. And so that's lowering the success rate of ex parte and really increasing the risk of churn and procedural denials from somebody who's eligible, not receiving the form or sending it in. So David, we're working on it. We have brought it up forcefully with CMS and are trying to kind of push for a little different interpretation. Our understanding is that it's kind of in the regs from ACA implementation. It wasn't a new thing pushed by FEMA, Verma, or others. It's kind of a long-standing thing that got some more attention due to some PERM reviews. But we think there is some flexibility there and something that we're pushing for, because it's really kind of devastating how much this can lower a state success rate and really take away the streamlining potential of some of these processes at renewal.
Thanks, Jen. Thanks, Fara. And again, if you'd like to ask a question, just use the Q&A function, or if you'd like to chat with us, use the chat function. You're also welcome to use the raise your hand function if you'd like to speak.
And thanks for coming on this journey with us. I mean, some of us, I'm speaking for myself, are more familiar with the MAGI world and more comfortable there. And a lot in the non-MAGI world seems to be on like Katie Beckett cases and pickle amendment and all of the things that are kind of intimidating when you look at the number of different categories and eligibility rules for the non-MAGI population. And I know there are so many great advocates out there, I'm sure some on this call, who really work closely with these individuals with high need to make sure that they're enrolled and that there's right calculation of their income and things like that. And there can be some really intensive needs among this population. But for those of you who do focus more on the MAGI side, I encourage you to expand a little bit into the non-MAGI world, because it hasn't gotten enough attention. And there are a lot of the kind of eligibility enrollment practices that have been pushed for years on the MAGI side that have some room for improvement on the non-MAGI side.
Looks like Louise would like to hop in, so I'm going to unmute you now, Louise.
Great. Can you hear me?
Yes, thanks, Louise.
I asked a couple of questions in the chat. I'm sorry, I should have put them in the Q&A. So one was, how realistic is it for us to try to get the state to integrate AVS into the real-time eligibility or ex parte process, which I would desperately like. My concern is AVS is with a vendor that's, there's going to be a new contract for maybe a different vendor in a few years, and that they'll say that isn't worth it. But I just don't know how the tech works. If they integrate with one vendor, would it be easy enough to switch to another vendor eventually?
I don't think that should be a big limitation. The hope is that these systems have been set up in more of a modern modular way, which is what we have seen from talking to the vendors and better understanding things, where it's kind of a ping to a data source. So think of it the same way as a ping to Social Security Administration or your state's Department of Labor. And I don't want to go all techie. I don't know if it's like an API or exactly what's happening here, but it's outside of your eligibility system. It's not Deloitte or Accenture, whoever, baking it into the substance of the eligibility system. So you already have a clearance process, or whatever your state might call it, where at application and at renewal, your eligibility system goes out, maybe to the hub, to state data sources, if you're not through the hub, to Social Security Administration, and pulls back information. This is just another data source that they should be interfacing with. In our paper, we talked a little bit about a batch process versus real time. The AVS is capable of a batch process, and that gets around some of the delay issues So at application, it can take up to 14 days to get a response from a bank. And that could lead to a caseworker sending out a request for information just in case the AVS doesn't verify the balance and some complicated things. But at renewal, that batch process can be run 14 days before everything else. And so those results can be sitting in the system when the ex parte process is run, and can be right there and available. So the bottom line is, I would say push very hard. Some states have begun to do this. It is certainly possible. And frankly, right now, there are 2 vendors that we know of in this space. I think every state is using PCG or Softheon. So the chance of switching vendors is not that great. And fundamentally, they're all using Acuity on the back end. That's the vendor that goes out to the banks and gathers the information. So there shouldn't be all that much variability there. So no excuse. I know that your state has a creative interpretation of ex parte renewals and how they go about it, but I would definitely encourage you to push on this point.
Okay, great. And one other question is there any source, or is any source sort of underway to get cash surrender value of life insurance? Because that's a huge obstacle for our clients to have to get that.
Not that we know of. I don't know enough about that world to know if there is some database, but I don't think it exists. I think it's all individual life insurance companies, and sometimes there's like unclaimed asset, unclaimed property at the state level that it eventually kind of feeds into. But that has been highlighted to us by states as far as a limitation. That's when I would encourage you to go with self-attestation or asset counting rules or something in that area to get around it, because I don't think there's anything on the horizon that would allow us to electronically verify that, unfortunately.
Great, thanks.
Thank you, Louise. So we have a couple more questions that came in. The first question is, can we use this if the client attestation and AVS results are both below the asset limit and the agency is requesting verification? And we have problems sometimes getting verifications, such as bank statements.
Yeah, I would definitely push back on it. They're requesting verification. The question is, where in the process is it? So again, if a client reported an asset and the caseworker has to request verification for something else, they might also say, hey, provide proof of your bank statement just in case we can't get it through AVS. But the situation you're outlining here is that the caseworker has the attestation and AVS results in front of them. They're both below the asset limit. There really is no reason for the agency to be requesting verification. And again, that's reasonable compatibility in the statute, in the regulations. This is not an optional thing. This is not about the reasonable compatibility standard that allows you to go 10% over the threshold. We're not talking about any of that. We're talking about the straight requirements. So I would certainly push back on agency processes in that area.
The next question is, are there specific populations within the non-MAGI population that it will be most politically feasible to start advocating for? And is this on a state-by-state basis, or is it safe to focus on non-MAGI populations overall?
That's a great question, Rhonda, and I think really gets into the advocacy strategy around this. So we know in certain states, I know your state can be challenging in this area, that working adults or working age adults are not the popular group to focus on. But when we're talking about children and people with disabilities and seniors, whatever resonates with your group, there could be a governor's work group focused on a certain population. There could be a really strong advocacy group, AARP or others that are working with seniors. So whatever avenue it is that will work in your state, that's a great idea to kind of focus in on a specific population. The changes that the state might put in place for that would hopefully apply across the non-MAGI population. But you could use that as kind of an entry point to gain attention to the issue, to build allies, often powerful allies in different arenas to focus in on children with disabilities or something like that. When Idaho had to change its renewal processes because of this changed interpretation from CMS, a lot of what they highlighted was Katie Beckett cases, which was children with severe disabilities who were able to receive Medicaid in order to stay home, and they were cut off. And you can only imagine the implications that had for a family and for an individual's care. So with this variety of populations that are covered, pick what might resonate in your state, use that as kind of an angle. And then if they're going to change it for one population, they really should change it for the entire population. So that's a great approach.
Thank you, Jen. So there are no more questions at this time, but if you'd like to ask another question, I'll give you another 30 seconds or just a minute or so.
Please submit questions if you have them, but I just want to thank you for joining us for this call. Please take a look at the ABS paper. And again, if you have different experiences or feedback from what's happening in your state, we'd love to hear more. We think this is kind of a beginning of the conversation around using ABS to streamline processes, and would love to hear more about what's happening in your state. And always, please reach out to us if there's anything we can do to help your efforts. All right, seeing nothing else come in, I want to thank you and have a great afternoon. Take care, everybody. Bye-bye.